Sis, why are you here?
Mom's gone crazy.
How'd you provoke her?
Excuse me? I didn't do anything. It's still about you and Ouyang. She asked me to mediate with both of you, but then you have your own plans. Then she asked me how it went. I could only tell the truth. So of course, she went a little crazy. She said to tell you that if it won't work, then just forget it. She said she'll find you someone better. She says if you stay in China, she'll find one here for you. If you go back to the US, she'll have Dad set you up.
No way, sis. Why does Mom want to interfere? You didn't try to persuade her, did you?
What are you saying, Shen? Can I even talk to her?
I know you'll be able to think of a way. Just find an indirect way to persuade her. Go and talk to her. I'm sure she'll listen to you.
Putting it off like this won't help anything. How long are you planning to put it off with her?
I don't know. Have I told you that the unique patient was admitted to the hospital? The dean's in charge of the case, and he's got specialists working with him. I'm in charge of pre-surgery, and I don't have time for Ouyang. How about this? You help me get Mom to calm down. Once I'm finished with this, I'll go talk to Ouyang.
What's so special about this?
Ewing sarcoma. It's a rare and often fatal case.
Ewing sarcoma? Is Dean sure about this? If there's the slightest slip-up, I mean, the patient might die.
I know. The dean cannot guarantee anything, but he wants to fulfill the patient's wish, so he's willing to put his job on the line.
The dean's a great person.
Yes. That's why all the staff in the hospital, including myself, are all rooting for him.
You've changed.
How'd I change?
When you were in the US, you were a complete realist and always logical. You'd never partake in something like this one. But look at yourself. Now you're agreeing with the dean, and that's surprising. Could it be that these people changed you?
You don't know the things that have changed in my situation.
Oh, come on.
Huh?
Oh, okay then. When you're ready to operate on him, let me know. I'd like to see.
You're interested.
Did you forget?
About what?
The consequences you'll face. Talk to the dean. Tell him to be careful. I'm serious.
Bye.
Just let me know when. I'll come watch.
Yes.
Everyone, we have set 8 a.m. tomorrow, so be ready for Wu Ran's surgery. So today we'll have doctors from thoracic, neurology, and ICU to do diagnosis. They are a team. Now I want everyone to think hard and discuss the problems that might occur during the surgery. It is extremely difficult. And the risks are high. And not only that, there are many unknown factors as well. We all know that medicine is a science, but this surgery itself, it transcends all the boundaries of medicine. Challenging an illness, I know it's not an easy task, and it is tough. I am not afraid to put my name on the line. It's quite clear that this surgery will likely fail, but I'm not scared. I don't want to back down because I'm afraid of failure. The patient wants to risk everything for this. So who are we to give up if the patient is determined to give it a try? So even if he dies, he wants to die without the tumor, and that is all.
Dean Chu, it's all right. We all know what this surgery entails for all of us.
All right then. Everyone notify their doctors. Be ready in 24 hours. If anything happens, then go to the surgery room. Although the time is set as 8 a.m. tomorrow, with Wu Ren's situation, there could be some issues.
He can't lie back then?
Yes, if he does, he can't breathe.
Wu Ren, we're operating tomorrow. Just hang in there. Don't be scared. You got that?
Dean Chu. Hello. Wu-Ran. Tomorrow is your surgery. I will ask you one more time. Are you sure about this?
Yes. I have to do it.
If he's so insistent, then we must go on with the surgery. All right. The surgery will be tomorrow at 8, okay? Mr. Wu, there's still enough time for you to say no. But Dean Chu, you have all heard him. He has decided my son is willing to die now. So the risk is on us, and not on you. All right then. We'll head back now. You should do a pre-surgery meeting, and prepare now the prep work.
Qianqian, talk to Wu-Ran's father.
Okay. Mr. Wu, come with me, please.
All right.
Mr. Wu, take a look at this. If there's no problem, then please sign this waiver. You got that?
Really? Where?
Right here is fine.
Okay.
Dean Chu.
Oh, hey Shen, come on in. Go on, sit down.
I want to talk to you about what you want to do with Wu-Ran's case. First of all, I personally admire your courage and hope I can be at the surgery table with you. However,
Go on, say it.
I took a close look at Wu-Ran's x-rays. There's almost no chance of success. I hope that you can seriously consider backing out on Wu-Ran's surgery. What do you think?
But Shen, we've all talked about this. There's no need to discuss it, and the decision is final.
I hope you don't intend to put your whole career on the line on this. You have too much to lose. I have a sister back in the US who's also a surgeon. She also had a patient with a similar case to Wu-Ran. The patient died during surgery. The aftermath of that was the family decided to sue the doctor and the entire surgery team, and they were forced to be dissolved. It's a real pity that such a talented surgical team is no more.
You see, Shen, I know what you are trying to say. I've done this my whole life. Of course I know all about the risks. But now, Shen, lots of people in this profession only do things that they are certain of. If they're not sure, they won't do it. With a success rate of less than 10%, you'll think that maybe it would be easier to just give up. Is that right? But if that person happens to fall in that 10%, that 1 in 10 who will survive, then we cannot give up on them. Or throw away that one ray of hope the patient still has to live.
Dean Chu.
Wu-Ran and his father have now made up their minds. Wu-Ran is gambling and holding on for dear life. So now if we fail, there's only one outcome, and that is death. In comparison, what does my reputation have anything at all to do with it? Is that my choice now? Okay, Shen. We don't need to discuss it. I have decided. If you think that this will affect your career as a doctor, you can back out. I'll respect that.
No, It's not like that. I'm not worried about myself. If you decide to do it, I will follow you. To the end, whatever the outcome.
All set?
Yes.
Let's begin then.
You're done already?
Mm-hmm. Anything else you need?
Aido-chan, aren't you tired of this yet? You used to be happy like this, and now you're sad like this. What's going on? Why did you decide to change like this?
Dr. Ouyang, do you really think I should always be cheerful like this? Being like this is bad?
Oh no, I'm just not used to it is all. I just think that it's a big change.
Okay, then I'll stay this way. Hello, Ouyang.
Hi, I'm surprised to see you. What are you doing here? Are you looking for Qingquan?
He sent me a message. I'm here to observe surgery, although I don't think I should go alone. Do you have time?
A surgery?
Ewing sarcoma.
Oh, I've got time. I'll go with you.
Thanks. Dr. Ouyang! I also want to observe the surgery.
All right, let's go.
Is she your intern?
Yes.
Oh, just loosen up.
How's everything going in there?
Not so well.
Is there a live feed?
Yes.
We'll observe from inside.
Okay, come with me. You can watch from here. I have to go ahead.
Thanks. This way. Here.
High loss of blood.
Notify the blood bank.
Got it.
Chu, are you okay?
Dr. Liu, please repair the damaged tissue of the diaphragm and pericardium. Please be very careful. I'll leave it up to you.
Okay.
Dean Chu, Mr. Wu, we have given it our best. The tumor has now been removed. The doctors are now repairing your son's damaged diaphragm and also his pericardium tissue. And then it's all a matter of post-surgery recovery, all right? Okay. All right then.
So what did you think?
It was worthwhile to witness such a surgery. Dr. Ouyang, Wu Ran should recover soon, am I right?
Well, if he can make it out of surgery, it's already a victory. However, we need to know about post-surgery. We have to observe the patient.
I came across something similar in the US. If he can last a week post-surgery, then that is good.
So it's like his sarcoma.
It was similar to this one, but even more serious. The tumor grew in a bad spot. The patient insisted on having surgery, so we respected his decision. US doctors, to come across patients like that, you're actually very lucky. But I think in the end it's... In terms of human illnesses, the doctor's ability is very limited. If a patient is willing to declare a war along with you, then you should do your best, because that special patient, they don't come often.
Then what happened?
Oh well. Next, we did the surgery on him, and then, unfortunately though, he died. So that means Wu Ran has a small chance? Actually, when Chuan told me that the dean wanted to do this surgery, I had to warn him to tell the dean to be careful. It's serious.
Why is that?
After the patient died, his family came to the hospital and decided to take the whole thing to court and sue us. Then we faced enormous charges because of the family. I took out a letter that the patient wrote me because we were really on good terms. In the letter, he said that his one wish was to finally get rid of that tumor. Because when he went to heaven, he said he wanted to go there without having it.
How did it end?
Well, in the end, we lost the court battle. So I gave up all hope. I decided to transfer from clinical to pathologic research. Actually, with this type of case, different people and different doctors will have many different views. Some will think it's risky, some will think it's a pity, but at the time, I thought if we all cared about protecting ourselves and our patients, well then, what do we need doctors for?
Right now it's like this. The patient is worried about overtreatment. The doctor is worried about mistakes, especially a doctor like Dean Chu. If he slips up, he'll be losing too much. His entire team may be affected by that mistake. And you know, doctors rely on their reputation and word of mouth.
Right. That's the crux of it, Ouyang. Whether in the US or China, there are two types of people, warm-hearted or cold-hearted ones. Cold-hearted people may seem very refined or elegant, but their heart is very cold. Whereas warm-hearted people will think what they can do and what more they can do. It is very easy to define them. You can see who are cold-hearted and warm-hearted. It's not very hard to tell them apart.
Right. All done? How is he?
Well, it's hard to say.
Let me introduce you. This is Qing Chuan's sister. She's a doctor as well.
Oh.
She came to observe the surgery today. He's the most warm-hearted person in the ER.
It is nice to meet you.
It's nice to meet you too.
Where's my brother?
Oh, you're waiting for Qianqian. He's with Director Liu. There's some post-surgery work. If you wait, though, it might take till sunrise.
Oh, then how come you're back already?
Well, Director Zhang sent me back. I am chief resident, right? So I can't miss out on my work just because of one patient.
Okay, I'll be off then. Will you walk me out?
No
Okay,
problem.
bye. Nice to
Bye,
meet
see you later.
Goodbye,
Zhao
Xiaoshan.
Shan, stay here with Chengjun for now. I'll be back soon.
Hey, what are you staring at me for anyway? Thing is, I'm kind of tired.
Dr. Chung, do you consider me a cold person?
Right now, you're not just cold. You're just not normal.
You don't like this?
I guess some people would.
Well, I can't really act like a dummy forever.
Oh, hold on now. Being dumb and not normal are completely different, all right? Wait a sec. ER, Zhang.
Hello, it's the hematology department. Director Tong called Professor Liu Daopei for the diagnosis of the patient named Qianqian. That's it.
Huh? Is that right? Good. I'll be there soon. Expect my arrival.
Yeah, sure.
Hey, hematology's coming for a diagnosis. And they got Professor Liu Daopei coming over. Send Director Zheng over there, huh?
That intern of yours is very cold.
Hard to get used to, huh? She wasn't like that before. I don't know what got her wires crossed. But it's okay. She won't last that long.
Yes. Everyone here is so warm. Even the coldest person will change for sure. Some of what I said was about my brother.
I can tell.
He used to be a realist, but now he is battling alongside the dean in the surgery, and I'm really happy about it. I can see that he's changed, and I know it's for the better. And it's all thanks to you.
I used to be like him. I think he changed because of the ER.
As for you and Xingxuan, I've addressed it before. I don't want to again. But these past few days, my mom's been reacting a lot. Actually, I don't really think that there's anything between you two that can't be solved. But waiting around like this, it might ruin the foundation you have right now. If it's possible, make up with him first. If there's any problem, then talk about it. You shouldn't make a big deal out of it.
Right. I'll give it some thought then.
Then I'll wait for the good news. Okay, I'm off then. Goodbye.
The patient has a high fever, respiratory infection, coughing, and gastrointestinal bleeding. We've used vancomycin, cephalosporin, and voriconazole, but the respiratory infection just got worse, and we haven't found a match as of yet.
I understand her condition, and I've read her history and records. It's a shame. This patient, the first time, she did HSCT. It was a bit late. It should have been done immediately, after her first recovery. She did a transplant after it recurred. It was just too bad. In this case, the chance of recurrence is high, very high. Well, of course, the transplant was successful, but the patient has a high risk of recurrence. And unfortunately, it was extramedullary, which means that it was mostly intracranial. Well, as you know, in the marrow, there are some drug-resistant cell strains. There you go, gentlemen. The situation here, it is quite delicate. 2% leukemia cells. That is why it wasn't ideal.
We're trying a dual strategy of chemotherapy and radiotherapy. We will try for a second transplant.
A second transplant. The possibility, definitely, it does exist, but overall, the post-prognosis of the second transplant is less than ideal. We have performed second transplants for 3 other patients, and they're all fine. This kind of patient is rare. With a patient like her, the effect of a second transplant will not be ideal. Acute lymphoblastic leukemia. If it recurs, we will have drug-resistant stem cells.
So, Professor Liu, do you recommend that we keep her in hematology, or would you like her to stay in the ER?
Keep her in the ER. Generally speaking, the treatment will be quite difficult. Because right now, you are merely alleviating all the symptoms she has right now. There are respiratory complications, which are serious, as you said. Serious respiratory complications can be terminal. First, you must control these respiratory complications, and that will be difficult. Then, we will go back and think about the acute leukemia. Treating the girl's recurring acute leukemia, the acute lymphoblastic leukemia. You have to think of chemotherapy that you haven't used, and whether or not to use radiotherapy. And if there are any kinds of drugs you haven't used before, you have to consider all of this. But as always, we as doctors, it's our job to comfort the patient. Kind words and assurances go a long way to put them at ease. And then when they are ready to accept it, you tell them the truth, and nothing but the truth. The patients have a right to know it, including their families. So you have to tell her, but please don't scare her. All right?
Right,
Yes.
right.
Very well. All right now. We can now begin treating the respiratory infection. Do you have any rooms, any available beds upstairs?
Properly. There are no beds available upstairs. Why don't we treat her here instead?
Seems like there are no available beds. Then keep her in the ER.
Okay then.
Keep her there for observation to control the respiratory infection. Next thing to do is to take her as an inpatient. We are aware there are many things to discuss with the patient and her family.
Yes. Thank you, Professor Liu, for your
For
cooperation.
the upcoming
Right.
treatment, I just need you to follow the guidelines that I gave you. Understand?
Yes.
Got it.
Thank you very
All right.
much.
Thank you, Professor
Very
Liu.
well. If there are any other problems, just call me. My phone's on 24 hours.
Thanks
Yes.
again, Professor.
Please take care.
All
Thank
right,
you.
Take care now.
This way, please.
Mr. Shah.
Dr. Zhang, how is my daughter?
There are no beds in hematology, but we're thinking of a plan. I just wanted to ask you if there's anyone else in your family. These past few days, you've been with her the whole time. If this goes on, it'll be hard on you.
Dr. Zhang, we've known each other for a while. And you know, Kexin's mother died when she was 8. With her condition, most of our relatives have all kept their distance from us.
So she doesn't have a boyfriend?
After she got her treatment, she worked hard to finish college and got a job. For girls like her, finding a boyfriend wasn't hard, but every time she did get one, she had to tell him about her leukemia and that it might recur. And that worked well, scared them off one by one. But finally, she found one who really cared about her. Said he didn't care. Yeah, and it was going well. They were to be married, Kexin and the boy.
But then, isn't that great? Where is he? We haven't seen him around yet.
I'm sorry. That was all my fault. I said I'd help fix up the house they were supposed to live in. After buying all the furniture and renovating the house, she had a fever. And then she collapsed. I tried contacting the boy. Unfortunately, couldn't find him anymore.
Is that true?
Who would do such a thing?
Well, we can't put the blame on him. Actually, he's a pretty nice boy and had been good to Kexin. Who would want a sick girl for a wife, though?
How about you lend me your phone? I'll go talk to him. Give me your phone.
Are you sure that's wise?
But what's wrong with that, huh? It's okay. Come on.
It's that one.
Dr. Chung, are you really going to call him?
Yeah, why not?
But there's no point in that. He won't answer. Isn't it obvious?
I still have to call. If I don't call, then how will I know what he thinks, right? What if he's just busy? Or maybe he hasn't made up his mind yet? The least I can do is try to persuade him, right?
If he had a conscience, then he would have been here days ago. And if he doesn't, 1,000 calls won't make any difference.
It's just one call. If we don't try, then how will we know, huh?
The person that you were trying to call cannot be reached.
Huh?
Sorry, the number you dialed does not exist. Please check the number and dial it.
You know what? If this cell phone weren't mine, then you know what I'd do? I'd smash it on the wall, then step on it. Why are there so many jerks anyway, huh? Come on, let's go.
I agree.
I know,
it is
right?
a little hot today.
Oh,
Shuzhen!
nice outfit.
Wait for me!
Are you Xiao Chong?
Huh?
Is this you in the picture?
Yeah, that's me.
I finally found you. Hello.
Oh, hi.
I'm Tang Tang. Tang is in Tang Dynasty, and the second Tang means candy. She's pretty good looking, and I think she's a bit older than him.
That bastard. Never knew he was such a chick magnet.
Oh, and you're supposed to be his teacher, right? How embarrassing that is.
Now, what does that mean? You want me to try as well? Well, it's not that I can't, you know. I'm too busy for that.
Oh, just try it once and bring a bunch in, huh?
This is great.
Pitiful.
Aja-chan, what's your opinion on this matter?
I don't have one.
Hey, good timing. Here, sit down.
What's up, Dr. Chung?
Let me ask you something. Why didn't you tell us you had a girlfriend anyway?
A girlfriend? I don't have one.
Okay, Zhao Chong, you're getting good. Better than your teacher now. It's like that old saying. How does it go now? A dog who bites doesn't bark.
What? Dr. Wang, how can you say that? Putting me and Dr. Chung together like that?
He's right. He's a dog who bites, and I just happen to be the dog who barks.
So you all got it? Is it that obvious? I'll conceal it more next time, huh?
Okay, I'm done. I have a lot to do this afternoon.
Oh, now, did you hear that? We still have lots to do, so we're gonna leave you and let you kids play. Come on. Come on, what's so funny?
Nothing.
Hey, don't eat yet. Interrogation time. Who exactly was that girl who came looking for you this morning?
You saw her?
Actually, she did.
What are you looking at me for? What? Can't I talk to a girl
But
anymore?
is there something going on between you two?
Why? Does it make it better if there is? Or there isn't any?
Oh, whatever. I don't care.
Oh, wait. She's not my girlfriend. She's just a fan of mine. Huh? She merely admires my talent.
You don't want to say it? Then I don't want to hear it.
Huh? What's up with her?
She's very sensitive when it comes to you, so don't upset her, okay? So tell us, is she your girlfriend or what?
She's really just a fan.
Oh, is that right?
Dr. Chung, don't underestimate the charm of my writing, okay?
Stop pulling my leg, man. You're full of it, and you know that. Go on, get out of here. Go to the office and organize some records or something.
But I haven't eaten yet.
You can eat while you do it, all right?
You better go.
You know what? At least he's got someone. Now I'm the only one left who's single here. Why doesn't anyone pity me anyway? Hey, so how have you been?
What do you mean?
You know, eventually you and Qianqian have to say something. You can't just go on like this. Besides, you want to be single like me forever?
What are you thinking?
That's why you have to find the time to sit down and talk to Qianqian, all right? Hey, you two are in touch, aren't you? What, are you just trying to communicate with your eyes? Do you really think that would work for you guys, just glancing back and forth at each other? Besides, if this goes on, it's practically the same as breaking up.
I'm full.
Who's that?
Hello? Yes, speaking.
Hi, sis.
Mom is gone.
Gone? What do you mean?
I think she went to meet with Ouyang. You should be careful. Don't let them meet. If they do, it'll make your lives harder.
Okay, I got it.
Sir, please settle the bill because the patient will be discharged tomorrow.
Chengzhen.
Yeah?
Is Ouyang busy?
Ouyang? She went outside for a while.
She went out?
Yeah.
Where to?
I have no idea. She just got a call and left the office.
A call? Do you know the person who called?
I really wouldn't know. Wait, is there a problem?
It's nothing.
You know, if there is a problem, you should just go and call her right now.
Okay, she's busy.
Okay.
Chengzhen. If my mom tries to meet with Ouyang, please call me right away.
Your mom's meeting Ouyang?
Don't worry about it, just call me.
Of course.
Thank you.
I'm sorry. Sorry, the number is busy. Please leave a message.
Auntie, please continue. You said you didn't want to leave, and I understood. You wanted to stay in the ER for a while, I understood that. But now your relationship's in a stalemate. It's not going anywhere. That I can't understand. Auntie, we only had a disagreement. We haven't decided how to deal with disagreement? You mean after you became chief resident, you got busier? Then Chen Qingchuan got worried, and now you wanted to leave him? Why was there a disagreement? That's only scratching the surface of the issue. But that's not what's really important. What is that we haven't prepared to fully accept each other and to change for each other. I think that we are all educated people here. I know you're used to using rational thought to explain your problems. But you're in a relationship. It's not the same as work. Suspending your dispute, that's a diplomatic term. What does cool down mean anyway? If after all this, that you're together, then that's fine. But what if afterwards you break up, what then? Do you mean all that Qingchuan's done? Will that amount to nothing? Auntie, that's not what I mean. Just let me finish first, huh? I don't want to use my son's sacrifice as a means to threaten you. He chose to do what he did. But you should also think about Qingchuan's future. After all, you're a doctor too. It's a very competitive profession. And you should know chief resident is just the beginning. Once you've been chief resident, you've only gotten your foot in the door. Later there will be attending doctor, vice director, director, lots of work and learning. And after that, there's still exams. Even if you don't waste a minute, you won't necessarily make it. If your mood affects your career, it could mean you don't necessarily make it where you want to be. This is especially true for a woman. You have to prioritize. You have to choose between your family and your career. If you choose to put your career first, then you might not have time to have children because of your work. But then if you put your family first, you might have to let go of your career. I'm not asking you to make a choice now. I'm just presenting the possibilities you may have to face. And that's all. You have to choose between relationship or career. You know, I didn't think that much or that far about it. I'm really sorry. You didn't do anything wrong. You don't have to apologize. Just think about what I told you. Even if you don't consider Chuan's potential, you should at least think about your own, right?
Yang, you met with Mom?
Qingchuan, we shouldn't do this anymore. I can't delay your limitless potential.
Don't listen to what my mom said.
I think she was right about you.
What did she tell you?
That we're both doctors. And we don't have too much time to waste on pointless arguments, right?
Wait. Do you know what she meant by that? Yang, you're not thinking straight. Think of the repercussions if you go through this.
I've made up my mind. Let's...
Hello?
Hello?
Director Liu, speaking.
What?
Wu Ran's in trouble?
I'll be right there.
I'm on my way. What happened?
What should we do? Let's call Din Shu.
There's nothing he can do. Nothing any of us can do.
Ren didn't make it. He's gone.
发现爱没有白天黑夜，我相信真爱会永远是心跳是直觉，爱的信念不会熄灭，勇往直前不顾一切。如果时间只剩一天，我还会为爱勇敢一点，再爱一天，再爱一遍，紧紧拥抱这个世界。如果心跳可以听见，就能听懂我爱的宣言，请让我陪在你的身边，在你的世界。如果时间只剩一天，我还会为爱勇敢一点，再爱一天，再爱一遍，紧紧拥抱这个世界。如果心跳可以听见，就能听懂我爱的宣言，请让我陪在你的身边，在爱你的世界 ，Love forever。